Today, I'm going to show you how to mobilize the bottom of your foot. The bottom of your foot has a bunch of joints, ligaments, and fascial tissue, but primarily there's a lot of muscles in there. And we can work on those tissues with massage balls. So here I have a lacrosse ball with a rubberized surface, a golf ball, and a large marble. But you can use any sort of hard ball like this to mobilize the bottom of the foot. I find the golf ball tends to be the happy medium that really gets a good release there. So what you're gonna do is you can place these massage balls or massage ball underneath your desk at work and just work on this throughout the day. Or you can just bring one to the gym or wherever you work out, and you can work on this foot mobility prior to exercise. What you're gonna do is you're just gonna place your foot on top of there. It's gonna roll from the heel all the way up to just the ball of the foot. You can do this in a seated position, a standing position, and you can use this with any of these balls. There's pros and cons to each one. Rubberized ball has a little bit more grip, so it doesn't slide out, but it tends to be a little bit big. The golf ball tends to have a good size to get into some of those smaller muscle groups, but tends to slide out. The marble here can actually work a lot into some of the lateral column here, which I'll be showing in a sec. And you're just trying to find any hot spots in the foot. Now what you can do is if you find those hot spots, you can kind of just sink into them, hang out there. You can even stand up, get your weight on it, and move the rest of your body while your foot is being pressed on with the massage ball. So you find that hot spot, move the rest of the body around. All I'm doing here is just moving the hips left and right. And that will really get into that hot spot, that tender spot on the bottom of your foot. You can do this all in standing, just kind of rolling out like this. And we can work anywhere from the medial column to the lateral column here. Now the lateral column tends to be tight in most people, tighter than the medial column, especially with people with a flatter arch, or tends to fall in like this. If they fall in, there's a tendency to be tight here and loose on the inside. So really focus your attention on the outside towards the pinky toe here. Even get up towards kind of like behind this bone, between this bone here, the fifth metatarsal, and the calcaneus or the heel bone. There's definitely some hot spots in here for most people, and that's really done best with the large marble, or the golf ball can work too. And that's right where the cuboid bone is. There's also a tendency to be tight in the medial arch here for people that have the stiff arch that can't go into a flattened position like this. If you can't get that, people tend to do really well with rolling out the inside ball of the foot here. And you can work anywhere along in there. And it's really important to stabilize and strengthen your foot afterwards. Now you may be pretty sore in some of these muscle groups at the bottom here. You may be even sore in some of the ligaments and joints and all the fascial tissue down there too. So it's important to know that the dose makes the poison. Don't push too quickly, because all these foot muscles have a tendency to be locked up, and when you open them up again, then they have a tendency to get really sore because they're not used to working. So take it slow, but if you do get sore, that is okay, as long as it's not excessive, because these muscle groups have to get strong to stabilize this new position.